Hi everyone. So for today's presentation, we will be talking about vitamins. So there's two categories of vitamins. There's fat-soluble vitamins and then there's water-soluble vitamins. Vitamins that are in the fat-soluble category is vitamin A, D, E, and K. They're present in food that mostly contain fat. They're hydrophobic and they can come from milk, supplements, almonds, and kale. And then vitamin D is usually coming from sunlight. They are absorbed through the lymphatic system and get digested by the bile. They're stored in the liver, adipose tissue, as well as skeletal muscle. And then they're able to be stored in the body for a longer period of time compared to water-soluble vitamins. So for the water-soluble, there's vitamin B and C. They're not usually stored in the body for a long period of time because it'll absorb what it needs and any excess will be excreted through urine. A continual amount is needed for a daily intake. And then they can come from foods such as fruits, vegetables, grains, supplements. A fun fact is the best way to have the most intake on water-soluble vitamins from foods such as vegetables is to steam or grill.
So for the next few slides, I'm just going to very briefly go over the physiologic roles or function and sources, as well as methods in absorption and excretion of vitamins A, D, E, K, C, and B complex. Vitamin A, or retinol, is a fat-soluble vitamin composed of retinoids and carotenoids. It's involved in tissue synthesis of wet membranes, white blood cell production, growth and development of numerous cell types, including those required in reproduction in endothelial cells, which are epithelial cells that line the body's cavities. As with all vitamins, vitamin A is available in supplemental and nutritional forms. This includes sweet potato, beef liver, spinach, kale, broccoli, pumpkin, and carrots. Fat-soluble vitamins, for the most part, all follow the same pathway of absorption and excretion. The absorption process begins in the small intestine, where the vitamin is converted from the food source into an active molecule, thereby distributed to and used by the cells of the body through the lymphatic system, and then finally the bloodstream. The vitamin is carried through the blood via carrier molecules known as lipoproteins. Excess vitamins may be stored in the liver and other cells of the body, while small amounts are excreted in feces. Next, we have vitamin D, or calciferol. Again, a fat-soluble vitamin, so follows the same methods of absorption and excretion when ingested orally, but it's important to note that vitamin D, most people receive this through absorption through the skin from UV rays. The primary function of this vitamin includes promoting the absorption of calcium and phosphate within the body for use, as well as assisting in the formation, remodeling, and growth of bony structures, along with the antioxidant properties it possesses, which include prevention and reduction of infection and inflammation. Food sources include fatty fish and fish oils, fortified beverages, and egg yolk. Next, we have vitamin E, or tocopherol. Again, fat-soluble. It follows the same trend of excretion and absorption through the small intestine, carried through the lymphatic system, metabolized by the liver, where the active form is then distributed through the bloodstream. Vitamin E also possesses antioxidant properties, aiding in immunological and metabolic processes. The key function of vitamin E is that it inhibits the formation of blood clots and prevents numerous forms of cardiovascular disease. This particular vitamin is more beneficial when taken through nutrition rather than supplemental form due to absorptive properties, and food sources include plant-based oils, various seeds and nuts, as well as spinach, collards, and beets. We next have vitamin K, or coagulations, fat-soluble again, so same absorption and excretion when ingested. The primary function of vitamin K is aiding in the production of proteins, prothrombin, which is responsible for blood clotting, and osteocalcin, which is responsible for healthy bone formation. Food sources include green collards, spinach, kale, soybeans, and soybean oil. However, vitamin K is primarily manufactured naturally by bacteria within the small intestine. We have vitamin B complex, which is water-soluble. It includes vitamins B1, 2, 3, 5, 6, 9, and 12. The primary function of vitamin B complex includes the conversion of glucose, amino acids, and fat into energy. Most vitamin B complex are found in both plant and animal sources. Vitamin B12 comes exclusively from animals. Food sources do include meat such as pork, trout, tuna, salmon, beef liver, and various types of beans, nuts, and chickpeas. As mentioned, this is a water-soluble vitamin, so the absorption and excretion is slightly different. Molecules are still absorbed through the small intestine, where the active form is then distributed directly into the bloodstream and used by the body system and cells. Water-soluble vitamins are not stored and are instead excreted via the kidneys through urine. Vitamin C, last, is ascorbic acid. Another water-soluble vitamin, therefore follows the same methods of excretion and absorption as vitamin B complex. The primary role of vitamin C is to aid in collagen formation and strengthening of the immune system to fight in both chronic disease and acute conditions such as the common cold. Vitamin C does possess antioxidant properties, so thereby reduces infection, inflammation, and the effects of free radicals. Additionally, it supports the absorption of calcium and iron in the body. High concentration food sources include citrusy fruits such as lemon, kiwis, oranges, grapefruit, as well as cruciferous vegetables. Finally, we're just going to take a really brief look at the vitamins required for maintenance and formation of calcified structures. So this includes vitamins A, D, K, C, and somewhat B. Vitamin A assists in the modeling and formation of bones, along with the formation of enamel and dentin in the preeruptive phases. Vitamin D enhances the absorption of calcium phosphate, thereby adding formation of all calcified structures, aids in the repair and remodeling of diseased bone. Vitamin K aids in the production of osteocalcin, which plays a key role in healthy bone formation. Vitamin B complex plays a significant role in the maintenance of healthy oral tissues, which thereby protect the underlying supporting bony structures. And last, vitamin C assists in the formation of bones and teeth in the preoperative phase by enhancing calcium absorption and assists in the formation and repair of all connective tissues, including the periodontal fibers and ligaments, pulp, dentin, cementum, and bone.
So these are the signs and symptoms of the hyperstates in fat and water-soluble vitamins. So for fat-soluble, it can lead to toxicity in the body over time with overconsumption, as well as lead to harmful side effects. So these are the signs and symptoms for vitamin A, D, E, and K. For the water-soluble, it's hard to observe if there are any, but it may interact with medication or blood test results. And these are the signs and symptoms of all the vitamin Bs that there are, and then as well as the vitamin C. So for the hypostate in fat soluble, it's usually that it may have an impact on the body negatively. It could affect from the vision to muscle movements. And then these are the signs and symptoms. And for the water-soluble vitamins, it can lead to high blood pressures, especially to diabetic individuals, or it may lead to disorders like beriberi or Wernicke-Korsakoff syndrome. So these are the signs and symptoms of all the vitamin Bs, and then there's a C.
Formulation of vitamin guidelines and how they apply. So for vitamin A, the recommended intake around 700 to 900 micrograms a day is helpful for the normal vision, the immune system, and reproduction. Vitamin D is from 15 micrograms a day. It's helped to keep the bone, teeth, and muscle healthy. Vitamin E is from 11 to 15 milligrams daily. It's helped to preventing cancer, heart disease, diabetes, and many other conditions have been disappointing. Vitamin K is from 90 to 120 micrograms a day. It's help the blood clot, preventive excessive bleeding, and vitamin C is 35 milligrams a day. It's help to protect the immune system deficiency and even the skin wrinkling. The reason for taking vitamin B complex is because it helps to prevent infection, support and promote growth of red blood cell, cardiovascular health, and healthy brain function. Each of the vitamin B complex have a different recommended intake. For example, B1 is 1.1 to 1.2 milligrams, or B2 is 1.1 to 1.3 milligrams, or B12 is 2.2 micrograms daily. The advantages of taking vitamin supplements: enhance your energy levels and focus. Getting vitamin supplements will provide you nutrients, so it will allow you to push your productivities and stay ahead to your tasks all day. Protect you from vitamin deficiencies. Vitamin supplements will enable to guarantee your body is supplied with all the nutrients needed, and also protect you from vitamin deficiencies. One of the reasons that make people more and more encouraged to use vitamin supplements is their availability and simple use. A tiny bottle and one pill every day can do a wonder to your body. There's also disadvantage of vitamin supplements. Vitamins overdose. This can cause problems to your health. For example, too much of vitamin could cause diarrhea and stomach cramps. Supplementation may cause interaction with other medication that the person is taking. Supplementation may cause systemic reaction that affect the entire body and health of the person is taking them.
Antioxidants are vitamins that protect the cells against deterioration and shield cells from the effects of the exposure to an environment that can cause cell death. Vitamins A, C, and E serve as antioxidant protectors from the damaging free radicals. Free radicals are made by reactions with oxygen atoms, which are highly reactive and are damaging body cells while looking for an atom to bond with until an antioxidant contributes the needed electron to the single atom to make it stable. And as you can see, that's what the diagram is showing in the lower right corner. And oxidative stress is the result of free radicals from damaging body cells and is related to cell damage, to cancer, some heart and blood vessel diseases, eye diseases, and neurological diseases such as Parkinson's and Alzheimer's. Antioxidant coenzyme Q10 is responsible for energy production in cells. It is found in vital organs such as the liver, heart, and kidneys, and also found in small quantities of fish, meats, and whole grains. Research suggests that a coenzyme supplement might benefit individuals who have had heart failure and improved recovery from heart surgery. It is also recommended that smaller doses of antioxidants found in food is more beneficial at preventing disease. Common oral manifestations of vitamin deficiencies. With vitamin A, you may tend to see xerostomia, oral leukoplakia, and enamel hypoplasia, which is shown in the picture here. Vitamin B deficiencies may result in red swollen lips with vertical fissures and angular cheilitis, which is what is pictured below. Burning smooth red tongue, which may be ulcerated geographic with atrophy papillae, and red ulcerated burning gingival tissues. Vitamin C deficiencies, you may see gingiva that is red purplish, swollen, and bleeding, which is signs of scurvy. Your client may also have loose teeth, slow healing, and irregular formation of dentin. And with vitamin D deficiencies, the oral manifestations may show that there is a failure of bone wounds to heal, enamel hypocalcification, which is shown in the picture below, and loss of alveolar bone and thinning of trabeculation. And with vitamin K, it aids in blood clotting. So if you are deficient in vitamin K, the failure of wounds to stop healing is a possibility, and blood doesn't clot properly. Vitamin toxicity is when excess amounts of a vitamin are absorbed into the body. Fat-soluble vitamins A, D, E, and K are more likely to produce a toxic effect because they can be stored in the body and build up in the fat tissues. Vitamin D is the most toxic as it enhances the absorption of calcium, so an excess amount of calcium in the bloodstream can be detrimental to the heart and the kidneys. Water-soluble vitamins B and C are less likely to produce a toxic effect because their storage is limited and the excess is excreted on a daily basis. Vitamin B6 and niacin are the most toxic water-soluble vitamins, and consumption of excessive amounts of certain highly processed foods and mega doses of vitamin supplements can result in vitamin toxicity. Vitamin imbalance is when too much of one vitamin is added to a diet, which leads to the deficiency of other vitamins in the body.
In this slide, we will focus on dental hygiene consideration referable to vitamin intake. So the patient might require to follow up to determine vitamin sufficiencies, chronic diet, denture patient, early childhood caries, periodontal disease, oral lesions, polypharmacy, and xerostomia. So the patient should take vitamin A if they have the oral deficiency symptoms such as xerostomia, hyperplastic gingiva tissue, or vitamin B if they have red, swollen lips, burning gingiva tissue. Vitamin C if they have bleeding gums, loose teeth, and slow in healing. Vitamin D is enamel hypocalcification, loss of alveolar bones. Vitamin E is there no deficiency symptom. Vitamin K is failure to stop bleeding.